This is Carl. Carl is a 23-year-old transgender male who lives in Halifax. During his third year at Dalhousie University, Carl began taking gender therapy hormones. He has experienced voice changes, increased facial hair growth, hair loss, as well as increased acne and weight gain. Carl is having difficulties as he is experiencing social isolation in his community, low self-esteem, and a lack of motivation. He does not feel supported by his family, and he has discontinued participating in activities that he used to enjoy, such as playing hockey, playing guitar, and attending church. Carl is also discouraged because he does not have a job, he lacks friends, and the ability to cook his own meals. Carl is concerned with his well-being, so he contacted the mental health crisis team, who had referred him to an occupational therapist to do an assessment. During the initial assessment, the occupational therapist observed that Carl portrayed symptoms that are consistent with those of depression. Carl and the occupational therapist worked together to identify and prioritize Carl's occupational performance issues. They then collaborated to set a SMART goal. At their next meeting, the occupational therapist decided that it would be appropriate to administer the Beck Depression Inventory to indicate the severity of his symptoms.
Hi, Carl.
Hi.
How have you been feeling since the last time we met?
About the same as last time.
Yeah, still not good?
No.
No? Well, the last time we met, you said you were struggling with low self-esteem, lack of motivation, and you were no longer participating in your leisure activities, and your priority was getting a job. Does that still sound about the same?
Yeah, it is.
Okay, so the plan for today is I'm going to administer this tool. It's called the Beck Depression Inventory Tool, and it's going to assess your symptoms to see where you're at right now. Does that sound okay with you?
Yeah, that sounds okay.
The Beck Depression Inventory is a 21-item self-report questionnaire to measure the severity of depression. It is designed to evaluate the affective and semantic components of depression, and it is sensitive to change over time. It is typically administered by a health professional who has been trained in its use and interpretation. A pencil and paper are required, and written instructions are provided. The assessment takes 5 to 10 minutes to complete. The health professional must ensure that the client understands the process of the assessment before administering the questionnaire. When administering the questionnaire, the lighting should be adequate and there should be minimal environmental distractions.
Okay, so I'm just going to get you to write out your name and your age. Okay, now I'm going to read you the instructions, and they're right here if you want to follow along, okay?
Okay.
This questionnaire consists of 21 groups of statements. Please read each group of statements carefully and then pick out the one statement in each group that best describes the way you've been feeling during the past 2 weeks, including today. Circle the number beside the statement you have picked. If several statements in the group seem to apply equally well, circle the highest number. Be sure that you do not choose more than one statement for any group, including item 16, which is changes in sleep pattern, and item 18, changes in appetite. Do you understand?
Yeah, I understand.
Okay, so I'm just going to leave for about 5 to 10 minutes, and then I'll come back in, okay?
Okay.
Once the client has completed the Beck Depression Inventory, the assessment is scored. Each question has 4 possible responses, ranging from 0 to 3, indicating the severity of depression. The client responds to each question individually, and the client's responses are added up to formulate a total score. Total scores can range from 0 to 63. The scores correlate with 4 standardized cutoffs, including 0 to 13, indicating minimal depression, 14 to 19, indicating mild depression, 20 to 28, indicating moderate depression, and 29 to 63, indicating severe depression. A higher score indicates more severe levels of depression. However, the Beck Depression Inventory is not a diagnostic tool.
Okay, Carl, you scored a 38 on the assessment indicating severe depression.
Okay.
But remember, this is not a diagnosis, okay?
Okay.
Okay. So next, my supervisor and I would like to talk to you about these symptoms of depression and how they're impacting your occupations. Is that okay with you?
Yeah, that's okay.
The Beck Depression Inventory is useful for occupational therapists because it highlights the connection between the body and mind by evaluating the affective and somatic components of depression. This assessment helps the occupational therapist to understand the client's thoughts, cognitions, and feelings. Each client is unique, and thus their scores and treatment planning must be addressed individually in a client-centered manner. However, the occupational therapist must be aware that self-report assessments are subject to bias, and therefore the results of the assessment may be inaccurate. With a comprehensive understanding of the client's occupational performance issues and identified goals, the occupational therapist must use clinical reasoning to interpret the accuracy of the results. Based on the client's highly reported symptoms, the occupational therapist draws a connection to understand how these symptoms may be impacting the client's engagement in meaningful occupations.
Hi, Carl. I'm Josh.
Hi, Josh.
Nice to meet you. So, let's go back to the result of this assessment. It gives us evidence and explanation that why you're having difficulty performing something meaningful occupations like trying to find a job, and also like this also can be impacting your ability to form supportive relationship, enjoy leisure occupation. Like you used to play guitar and hockey, as I learned from the reports, and it is also possible that the social environment also contribute to those feelings of depression. So with all that being said, are any of these sound accurate to you?
Yeah, no, that's accurate. But one thing that I'd like to talk about is my past suicidal thoughts. I'm really worried that might happen again. So.
Would you like to talk about it now?
No, I think I'd feel more comfortable talking about that to a psychologist or something.
Right.
Yeah.
That's fine. If you don't feel comfortable talking to me and Brianna, but I can refer to someone else. But while you're here, let's revisit your goal of wanting to find a job.
Yeah. I'd really like that actually. I think maybe working on building my resume might be helpful at this point.
That sounds like a good place to start.
The Beck Depression Inventory is not a diagnostic tool. It should be used cautiously because depression may accompany a variety of primary diagnostic disorders ranging from panic disorder to schizophrenia. It is important that the occupational therapist examines the overall pattern of depressive symptoms rather than relying on the total score alone. Because depression may be associated with suicidal risk, an occupational therapist must be able to respond to clients in an appropriate and safe manner. The occupational therapist should have specialized training to provide a full range of therapeutic interventions or referral mechanisms to address suicide. The occupational therapist must also be aware to indicators of possible suicide risk. An occupational therapist may choose to use the Beck Depression Inventory to measure the severity of depressive symptoms in a mental health setting. Literature has shown that it's an appropriate assessment for both clinical and research settings. Because of its high responsiveness, it is an excellent tool to assess changes in depressive symptoms over time. Therefore, an occupational therapist can use it to determine the effectiveness of treatment. The Beck Depression Inventory is also intended for clients aged 13 years and older at a grade 5-6 reading level. Although it requires active participation by the client, it may be administered orally to compensate for varying literacy abilities.
Hey, have you guys ever done the Beck Depression Inventory?
Yeah, like I was actually just doing some research, and it's a great standardized assessment.
Tell me what you mean.
Yeah, so it has really good psychometric properties. It has high internal consistency,
Right.
test-retest reliability. It has high content, construct, and concurrent validity.
Oh, I didn't know that.
Yeah, and it also has really great clinical utility. Although it requires training, it can be self-administered. It doesn't cause administrative burden. It only takes 5 to 10 minutes to complete. It has high cultural applicability because it comes in like several different languages. But it's like over $200 to purchase.
In Carl's situation, his score indicated that he had severe depressive symptoms, but this was not a diagnosis. Because Carl was referred to the psychologist, the occupational therapist and psychologist will collaborate to formulate an individualized treatment plan. The occupational therapist will revisit the Beck Depression Inventory post-treatment to reassess Carl's symptoms and monitor his progress. I need you.